Today we are announcing the first death in an individual with the new H1N1 strain of influenza. This individual who lived in the central part of Los Angeles, had an underlying chronic condition. And the individual was a woman and was middle-aged. So we are announcing today the first death in Los Angeles County in an individual with H1N1, the new strain of H1N1, a middle-aged woman in the central part of Los Angeles County. Deaths from and associated with the new H1N1 strain are not unexpected. Let's remember that in an average year, we would expect as many as 1,000 deaths from complications of flu in Los Angeles County with the regular varieties of seasonal influenza. And it appears that the case fatality rate of this new type of flu is very similar to what it is with seasonal influenza. To date in Los Angeles County, we have 102 confirmed cases, 19 probable cases, and we have 9 hospitalizations of individuals with the new H1N1. But the good news is that in Los Angeles County and in most of the rest of the country, that the frequency of new cases is going down. And of course, most cases have been mild to moderate, and a number have been inapparent. In other words, people have been found to have had this H1N1 but didn't have any symptoms whatsoever. We continue careful monitoring, working with the state and with the Centers for Disease Control. We are looking ahead also to next fall and watching to see what strains of influenza are likely to be here. It is a good time to remind people that when the opportunities for vaccination for the new flu season occur this fall, that they should get immunized against the seasonal flu strains that are most likely to be here. It is also important to remind those at high risk and those over 65 who have not yet received a pneumococcal vaccine to get it, because this is again another type of important protection. What can individuals do? Well, the standard things that we've been talking about, which is number one, to wash your hands well and frequently for at least 20 seconds, to cover your cough, to cover your sneeze, to not touch your eyes or your nose or your mouth with your hands, because the flu virus can live on hard surfaces for well over a day in some cases. And if you're sick, to stay home and not send your children to school until 24 to 48 hours after the end of your symptoms.